That work has to be researched.
It certainly does, and as you mentioned, this burn clinic in China with the amazing results you get with burns. Well, we've all know, all beekeepers have known for years, the best treatment for burns is put on liberal applications of honey.
Well, of course, honey's got the glucose oxidase, which converts to hydrogen peroxide, so you have the antiseptic and antibiotic properties, and you have a coating of the wounds to keep the oxygen out and keeps the tissue moist. It's ideal.
And also the levulose, dextrose in the honey being assimilated immediately by the body, the cells of the burns actually seem to absorb the honey for nourishment.
Now that, for example, is that we could design a very simple test with burn tissue and honey.
Sure.
And yet that takes time and money, and it takes people who are knowledgeable and interested. The society can generate the interest in these people. We have many scientists who want to learn more about this now, who would be willing to do the research if we could supply the funding.
Yeah.
So again, it gets back to fueling the engine with enough funds to be able to get the research done.
Sure. Well, that's always a problem, and the greatest handicap, of course, is that this research is not self-generating of funds. Selling honey at a high profit is very difficult because everybody's trying to sell it at a very low price, so you don't stand a chance.
Thank you. So here's a substance which could be close to an ideal burn ointment, which is going for $1.50 a pound, right?
Yeah, or less.
So as I've observed your practice, and you go ahead and treat people, you don't tell them to come back.
You know, if they've got a chronic case, which is going to require a lot of treatments, I say, now this is going to take a lot more treatments than I can give you. What I'm going to do is I'm going to show you how to treat yourself, get your own supply of bees, and continue the treatments when you get home.
I know, I think I need to be stung. I know that. And I get my jar of bees and my jar, and I go out to my hive and I get some bees, and I come back in and sit at my kitchen table. I'm here and I just take care of myself.
So you actually design it so that you're out of the picture in a certain point. You teach them, and then they become autonomous, and they treat themselves.
And then it's up to them after that.
To me, what autonomy is being able to take care of my own needs. That's what autonomy is. And it's pretty nice to be able to take care of your own needs.
And many of them go on and become beekeepers and treat other people. And so you've actually perpetuated, you've duplicated your efforts in that way.
Those that succeed become enthusiastic, and if they have the will or the interest, they'll continue treating others. So that's how it's so slowly going.
And it's not a financial burden. I mean, there's just so many things, and I know I'm not taking one drug to help one thing, but at the expense of another system. You know, it actually is a tonifier for me, so it's helping many systems, and it's quite something. I encourage people. You know, an adequate clinical trial is 6 months to a year, so I encourage people to really play it out.
Now, if somebody lives 50 miles away, how are they going to come and see me 3 times a week? You're wasting your time and money. Take the bees, treat yourself right at home. You'll get just as good results, and it won't cost you anything. In other words, it's the old story of physician, heal thyself.
The word for doctor comes from the Latin ducere, which means to lead or to teach, and you're a teacher. In that sense, you're a real doctor. You teach people a technique, and you teach them to become autonomous. It's like instead of giving them fish, you teach them how to fish.
Yeah, teach them to be able to help themselves.
In America, we get sold a great advertising spiel about this or that artificial drug, and the other countries, like Mexico and so forth, are left to go consult their grandmothers.
Sure.
And they, in fact, use powerful natural remedies, which is part of their cultural tradition.
The American public is always looking for that magic pill, and a person has to really learn to heal themselves. You know, they depend too much on a doctor to cure them with a pill with no effort or anything on their part. And you can't cure yourself like that. You got to make some very big sacrifices and work at it to cure yourself. There's nothing magic about it. Mm-hmm. It's just a lot of hard work, self-discipline.